Hey guys, so today I'm going to be talking about um, the musculoskeletal joint and eye drugs. Now, the musculoskeletal and joints kind of go together, but the eyes don't really connect. So I'm only doing it because they're both really short. There's not a lot of drugs to know, so we're just going to do it all in one week. I might even add the gastrointestinal drugs to this week as well if we're behind on our drug lists. So, but I'm just going to do those two in this PowerPoint. So I'm going to present. It's going to be pretty short. Okay, so let's go to slideshow, play from the start. Okay, so we're going to start with the musculoskeletal and joint drugs. So let's talk about musculoskeletal pain. It's pain that affects the muscles, ligaments, tendons, joints, and bones. So it could be any of those. And some drugs treat pain, while other drugs treat conditions associated with low bone density or muscular issues. So it depends on what it is and how it's going to treat that particular issue. Okay, so what is musculoskeletal pain? Well, the causes are pretty varied. It can be anything from trauma to wear and tear from daily activities. So as you get older, you'll probably hear your parents talk about, or even grandparents talk about, they hit a certain age and then everything starts hurting. So that's kind of what can happen over time. Trauma to an area can be an issue. So jerking movements, auto accidents, falls, fractures, sprains, dislocations, and direct blows to the muscle can cause musculoskeletal pain. Other causes can be postural strain. So, bad posture, repetitive movements, overuse, and prolonged immobilization. Changes in posture and poor body mechanics may bring about spinal alignment problems and muscle shortening, therefore causing muscles to be misused and become painful. Conditions such as arthritis can also cause pain in muscles and joints. So anti-inflammatories, we've got NSAIDs. We talked about this back in our pain management section, and so you'll kind of notice some of the same drugs. But I tried to put the main ones that treat musculoskeletal pain in this one. But over-the-counter drugs, obviously Advil, ibuprofen, Aleve, Motrin, all of those are anti-inflammatories or NSAIDs that can take away pain. So those are usually the first course of treatment before you get a pretty hardcore prescription drug, especially like pain drugs or pain management drugs. Colchris is an anti-inflammatory prescription drug specifically treating gout, and we'll talk about gout a little bit later. Ooh, sorry guys. I am like super tired today. This baby is jumping all the time at night now and keeping me up. So I'm trying to wake up because it's early this morning. All right, muscle relaxers or muscle relaxants are medications used to treat muscle spasms or muscle spasticity. Muscle spasms or cramps are sudden, involuntary contractions of a muscle or group of muscles. They can be caused by muscle strain and lead to pain. They're associated with conditions such as lower back pain, neck pain, and fibromyalgia. And some muscle relaxants that are pretty common are Flexeril and Xanaflex. I think both of those are actually on your top 200 drugs lists. And probably everybody has had muscle spasms before. Most of the time, it's not bad enough to have a muscle relaxant, but sometimes it's necessary. Okay, so gout. We talked about gout a couple of slides back, but it's a common and complex form of arthritis that can affect anyone. It's characterized by sudden, severe attacks of pain, swelling, redness, tenderness in the joints, often at the base of the big toe. Like that can be where it starts. One example that kind of helps reduce the uric acid in the body is Xyloprim. And that's basically what causes it, is a buildup of uric acid in the joints. And it kind of crystallizes and causes pain. They don't know what causes it. They said there's a genetic link associated with it. A lot of people will have it in their family, but then some random person will get it and never have had anyone in the family with it. So it's interesting. Okay, osteoporosis and bone health drugs. So osteoporosis literally means porous bone and is a disease in which the density and quality of bone are reduced. As bones become more porous and fragile, the risk of fracture is greatly increased. The loss of bone occurs silently and progressively. Often there are no symptoms until the first fracture occurs. A lot of times this is with people, especially women. It's a much higher risk in women than men because men tend to have higher muscle, amount of muscle in their body as opposed to women. Women really have to work at that. One of probably the people who would be at most risk are really skinny women who have trouble holding fat or muscle on their body. And as they get older, if they don't do something about putting muscle on, because muscle helps with bone, keeping your bones healthy. If they can't put on weight or put on muscle by lifting weights, eating better and more, there's like lots of factors and ways to do that. But if they can't do that, they can be at a high risk, especially real older ladies. So if you're like really thin in your 50s and 60s, you should probably try to put on some muscle, because that will help as you get older. Because I think it's a lot harder when you're probably 80 to be like, I should start working out and put on a little muscle to protect my bones. But if you do that earlier on, you can kind of maintain it as you get older. And yeah, usually bigger women, even if they have a higher fat content, a lot of the times will have more muscle anyway. And so they probably don't have as much of a risk. But yeah, and then drugs to treat osteoporosis would be Fosamax or Boniva. So those are the two main drugs that help with that. All right, and then ophthalmic drugs, there's just a couple. So one of the biggest things, or the biggest issues in the elderly when it comes to blindness is actually glaucoma. It's a group of eye conditions that damage the optic nerve, the health of which is vital for good vision. The damage is often caused by abnormally high pressure in and behind your eye. And glaucoma is one of the leading causes of blindness for people over 60. Common treatments can be Xelantin or Alphagen. And then, so that's glaucoma. But then eye allergies are a lot more common to pretty much everybody. I mean, I have allergies right now, and eye allergies and nasal allergies just from, the leaves falling and the seasons changing. My eye, if you can see this eye, actually, you probably can't, but is red. I woke up with it red yesterday, and I think it's just from the changing of the weather. But when I'm actually, you probably won't see this till the spring, but I'm recording this in the winter time, or the fall in like November, because I'm preparing to have this baby. So I'm making these videos early, but yeah, you guys will probably be hitting another season change soon, which will affect can affect your allergies too. So that is it. Oh, and I forgot to tell y'all, oh, they're not on here. Visine and murine. Those are two that can help put moisture back in the eyes, help with redness, irritation in the eyes if you have allergies. Whew. Sorry guys, y'all are gonna like literally be like, all she does is yawn all through these lectures. I'm so sorry, you guys. I can't help it. I'm pregnant. Okay, so let me stop presenting here. So that is it. Miss Walsh is gonna go over the drugs list with you. Because I don't have it filled out yet fully because I updated it. But when she has the list, or when she finally, takes over for me, she'll have the list and go over it with you guys. Make sure y'all get it correct. And yeah, that is going to be it for today. Have a great one, guys. Bye.